So the problem is that we have a Medicare rebate system that has been indexed at a very low rate and not kept pace with the increasing costs of practices in actually having to provide the services that their patients need. Our practice costs have continued to increase. And so more and more doctors have been, of course, charging gaps because that distance between the scheduled fee and what it's costing them to run their practice is increasing. We know that private health insurers have no gap arrangements, and in fact 89% of services are done actually under a no gap arrangement, another 4% being done under known gap arrangements. So that only leaves 7% where there is actually a gap. Now, we hear stories about patients that are charged what we would consider exorbitant fees, and the AMA does not support any specialist charging fees that are exorbitant. Now, how you define that, of course, is difficult. I know the College of Surgeons has said exactly the same thing, but I do support the ability of doctors to charge the fee that they feel is appropriate for their service. I think we need to make sure that when there is a gap that we use informed financial consent, but patients need to understand that they do have the ability to go and seek another opinion to see whether another doctor might be able to provide the service at a cost that's more appropriate for that particular patient. And patients should never feel coerced into paying any amount of money out of pocket that they don't feel comfortable with. The practice costs are actually quite expensive. Most of us employ a number of staff. We have premises that we lease and equipment, particularly in some specialties. The equipment that they actually have in their offices is actually very expensive to own and run. We know that in some cases there is equipment used in the surgery that also attracts an out-of-pocket payment. I think we have to realise that the costs of medical indemnity are also particularly high. They can be $80,000 a year in some cases. So all of those costs have to be covered before the practitioner is able to earn an income. So we need to ensure that doctors of all descriptions are able to charge the fee that they feel is appropriate to the type of services that they provide. But by the same token, we want to make sure that patients are not in any financial distress from actually accessing healthcare.